My name is Ben Noor. I'm the Director of Partnerships for the Texas Restaurant Association. If you're on this webinar, you're probably familiar with the TRA and what we do, but we are a trade organization. We support the restaurant industry, and we also have a lot of partners that can support not only the restaurants, but also your employees, which is why we're here today. This month is Mental Health Awareness Month, and so we thought it'd be appropriate to bring in our preferred partner, Teladoc Health. Before I introduce our speaker today, I'd like to talk about a few housekeeping rules. Feel free to drop any questions in the chat. There'll also be a Q&A at the end. We are also recording this session, so for those that may have missed it, I'm aware that people up in Dallas may be still without power. Don't worry, we will be posting this on our webpage along with our YouTube page, so you will have access to that after the fact. And those that may be with our preferred insurance broker, Higginbotham, they work closely with Teladoc Health. Andrea has a great relationship with them, so there could be some opportunities there. So without further ado, I will introduce our guest speaker today, Andrea Sadler. Bear with me 1 second, Andrea. Sorry, I had your bio pulled up and now it's gone. So technical difficulty there. Okay, so Andrea Sadler is a director of broker sales at Teladoc Health. She joined Teladoc Health in 2018. Prior to joining Teladoc Health, Andrea worked at United Healthcare in Phoenix, Arizona for 25 years as a sales executive and a leader in the small group market. She is passionate about helping people discover the advantages of telehealth to improve their health and well-being. Andrea, I'll pass it off over to you.
Awesome. Thank you so much. Thank you to all of you for spending some time with me today. I promise this will not take a full hour, probably 20 minutes max. So let's go ahead and get started. And as Ben mentioned, I am a director here, but I also manage the hospitality partnership here at Teladoc Health. So this is what I've got lined up for us today. I'm just going to give you a quick overview of who Teladoc Health is, highlight the importance of offering some type of employee benefit, and then dive into a brief discussion about mental health and how it's affecting Texas directly. And then lastly, provide you with our virtual care solution that can be offered to any of your employees. So Teladoc Health. Some of you may have heard of us or may have even used us. We actually opened our doors back in 2002, believe it or not. And today we're recognized as the global leader in virtual care. We were the first telehealth company to hit 1 million visits in 2015. And today we deliver more than 20 million visits annually, and we serve more than 90 million people around the world. So as Ben mentioned, we partnered with the Texas Restaurant Association to provide you and your employees the 6 services that you see here in gray. So general medical, mental health, dermatology, digital physical therapy, believe it or not, it's really awesome, nutrition, and expert medical services. I'm going to come back to this a little bit later. I just wanted to highlight this for you and focus a little bit more on mental health. So with that being said, what are some of the challenges you are facing as an employer? I'm sure there are many. One of the main reasons regarding healthcare could be the lack of access that your employees have. You know, many may not have any type of insurance or healthcare benefits. So when they're sick, they may call out, leaving you short-staffed, or even come to work sick, getting their patrons and other employees sick as well. You know, and as a result, absenteeism and presenteeism can be very costly for you as the employer. And I thought this was an interesting slide here as it relates to, you know, why is it important for you to offer some type of employee benefit? We know that benefits are expensive. Most employees opt out because they can't afford it, but you still want to offer something to recruit and retain your top talent. So just a few stats here that popped out at me. 67% of job seekers say that benefits have gained more importance since the pandemic. and 58% of employees cited that benefits are a major factor in staying with an employer. And then lastly, we've seen a 35% reduction in productivity for employees with unresolved depression. And that's a great segue into the heart of this presentation. So let's talk about mental health for a minute and how it may be impacting your business. So despite increasing investments in mental health resources, the demand continues to outpace capacity, right? We've seen a 60% increase in mental health since the pandemic, and people are waiting way too long to get help. And over 60% of our youth with mental health needs are going untreated. And you, the employer, may certainly be feeling an impact of this. Let's look at the lost productivity stat. Mental illness drives 200 million lost workdays every year at a cost of $17 to $44 billion to employers annually. And one of the main barriers of getting help is the lack of access of providers across the United States. Many people, live in areas where providers are minimal and they have to drive hours or wait weeks or even months to get seen. And looking at Texas here, it looks like all but a few counties are in shortage. And speaking of Texas, I actually went to the National Alliance on Mental Health Illness for the state of Texas and got their most recent data, but their most recent data is 2021. So we can only assume really that these numbers have increased, right? So a couple of stats that popped out at me. About 3.5 million adults in Texas have a mental health condition. Almost 800,000 adults have a serious mental illness. And here's where I'm very naive because I don't know how many people live in Texas. I'm assuming a lot, right? But when I saw the stat of over 15 million people in Texas live in a community that does not have enough mental health professionals, I was shocked. So keep that stat in mind because as I move through this, I'm gonna go back to this particular slide. But all right, so while the barriers to care are numerous, the quality of care and outcomes really boil down to three things here. Number one, can individuals access the care when they need it? Number two, are symptoms being identified early and addressed regardless of where they present? And number three, are the individuals guided to the right care or mix of care based on their unique needs? So next, what I want to do is show you how we can address these barriers for your employees. So here at Teladoc, and this benefit that we've created for the Texas Restaurant Association, we have a single place to turn for any level of mental health support that's needed. So our mental health solution will guide members to the right mix of digital and clinical services according to their individual needs. So with self-guided digital programs, live coaching, therapy, psychiatry, and even crisis management, your employees can rest assured that they're going to be provided with the right care to address their needs. So what I want to do now is just briefly show you how it would work. So it's all app-based. Members can easily log in from anywhere. They're going to answer a few questions to assess their symptoms, as well as any life events that may be impacting their mental health and well-being. After the assessment's completed, the member will receive a personal plan that's created to deliver that right mix of care that reflects a balance of what the member actually needs and wants. And then as the member progresses through their journey, ongoing assessments are provided to help the member track their progress and really zero in on areas that require continued focus. So some of the things that we offer, we have access to coaching and therapy, and it's very simple. Members will be matched to a coach or a therapist, or they can choose one within the app. We provide profiles and all the data on the therapist. And then they can schedule an appointment, meaning the member that works with their routine. And then they'll conduct a virtual visit right in the app, and that visit's about 45 to 50 minutes. We additionally have psychiatrists who can diagnose and treat mental health conditions with medication management. I get asked that a lot. So, you know, this benefit, and I am not too, I mean, I use all of our benefits all the time, and I can tell you that it is priceless because it really does provide convenient access to care without the employee having to leave their home or even leaving work, right? They can have an appointment at work. And it's not going to cost your employees anything to meet with any of our providers. And I'll get into that more here in a minute. But as I mentioned that slide about Texas and the shortage of doctors, what's great about this is we have over 7,000 vetted and extensively trained mental health providers nationally. And 30% of our clinicians actually hold multi-state licenses, which really broadens our network for Texas and every other state. And as a result, your employees are guaranteed to have their first visit in 7 days or less. And all of our visits can be conducted 7 days a week, anywhere from 7 a.m. To 9 p.m. And then in addition to the therapy, we provide recommended digital exercises that target the specific areas that the member needs to work on in between their sessions. And this particular example you see here on the screen is an exercise using mindfulness as a way to process depression. So in this particular program, the member will learn about what mindfulness is and how it works. And then it'll dive into a 5-minute audio meditation focusing in on that depression. And then also between sessions, a dedicated coach is there to provide one-on-one support, answer any questions, offer encouragement, and guide members to content and activities that can, you know, really help them maintain progress and improvement over time. And then once members achieve their health goals, right? So they graduate from their live sessions and they will move into more of a maintenance mode by engaging in those self-guided digital exercises that help them continue to develop coping and sustaining improvement. However, a member can always choose to speak to a therapist at any time, as there's no limits to the number of times our members can meet with our provider. And then lastly, I get asked this a lot. What do we do for crisis management? Well, we have a tool built in. So we have a whole support team that's embedded within this service as well. And the triggers are actually based on assessment responses, natural language processing of keywords, and interaction with therapists and coaches. So what we provide is in the moment provider intervention, immediate phone outreach to the individual by a trained crisis manager, and then digital crisis planning to help members recognize distress and learn strategies for coping in day-to-day life. So if you're like me, you know, you like to read reviews on everything, you know, before you buy it or before you consider it. That's why I like showing this particular slide, because evidence is really showing that members are getting better over time. And our data is showing that members with depression or anxiety have experienced measurable improvement in just 3 to 4 days. So what I thought I'd do, I don't have many more slides to go through here. Hopefully right now you're asking yourself, okay, this is interesting. You know, how do I purchase this? How much does this cost? But I think I'll pause it right here, Ben, and see if we have any questions before I get into that.
Yeah, sounds good, Andrea. Thank you for that. For those here, please drop your questions in the chat. Andrea, there is one that was that dropped. How fast does it take for someone to see a therapist once they sign up?
So a therapist, it's 7 days or less. So once they go into the app, they're going to have access to all of our providers, and they're able to choose their own provider, and that provider will provide their schedule. And we mandate that providers cannot have their visits be any longer than 7 days, more than a week, I guess is what I'm trying to say. So it's 7 days or less. A lot of times folks can get in to see our providers in less than 7. Great question.
Awesome. And the next question, what does onboarding look like if I wanted to provide for my employees?
That's a great segue into what I was going to talk about. Well, before I get to that, are there any other questions or?
I'm assuming you're gonna, in this next segue as well, you'll probably talk about best practices in using the Teladoc Health.
Yep.
Great.
All right, so let's look at what it is, and then I'll talk about the onboarding. That was a great question. So going back to the earlier slide that I showed, this benefit we built for the Texas Restaurant Association. Again, all of the services that are here in gray are part of this program. Each one of these services have unlimited usage. So if somebody wants to talk to a therapist every single day for the next year, it's not going to cost your employees anything to do that. So it's each visit or each service has $0 copays. And the price of this is $9 per employee per month. And the employees can also add their dependents for no additional charge. So before I get into the onboarding, I just want to run through the 6 services here. So we have the general medical. Again, I use these services all the time. I just used this about a month ago. I wasn't feeling well. I picked up my phone, went in the app, selected a visit with a doctor. They called me back in 5 minutes, and they wrote a prescription for me at the pharmacy that I identified within the app. So that's a 24-hour, 7-day-a-week service. We've got the whole mental health complete component that I just talked about. We have dermatology. Believe it or not, this is utilized a lot, and I'm here in Arizona. I've had skin cancer. Just recently used this as well. And why I love it is I'm a procrastinator, and it will take me forever to make an appointment with a doctor. So here I have access to a dermatologist that will review any photos that I upload. And thank God I just did it, because they actually recommended that I go in and see a dermatologist because I needed to have it biopsied, and it came back squamous cell skin cancer. So for me, this is priceless. I have access 24/7 to a dermatologist. We've got digital physical therapy. I'm super excited about this. We thought this would be also great for the hospitality industry. We work with a company called Sword Health. They have physical therapists, super cool benefit. And I've just enrolled and I'm waiting. They will send me a tablet with my exercises already preloaded, and I have motion sensors. I have back issues, so I have motion sensors that will monitor the exercises that I'm doing. And then I have a physical therapist that I will work with on a weekly basis, who will help me, stay motivated, right? And help me modify the exercises if needed. So great benefit there. We have nutrition. We have registered dietitians that will help folks set up eating plans and shopping guides, another great benefit. And then the last one, our expert medical services, is a second opinion service where folks can get a second opinion from doctors all over the world should they be diagnosed with, let's say, cancer or some type of musculoskeletal condition, etc. So again, all 6 services are included at $9 per employee per month. And getting to the onboarding process, super easy. One thing though, I do want to mention, this is not meant to replace health insurance. But obviously it's still essential, and it's a nice array of healthcare services, and it's really a low-cost way to offer a robust benefit to help you recruit and retain that top talent. So onboarding is super, super easy. Just requires 3 steps. There's a new group setup form that would be filled out virtually. We send you a service agreement to sign, and then we'll send you instructions on how to upload your employees in your own client portal. We're going to build you your own client portal where you can add and terminate employees at any time during the month. All employees can be offered this benefit regardless of their hours worked, whether they have insurance. And again, remember, the employees can also include their family members at no additional charge. And you just need 2 enrolled employees to start the plan, and then you can add and terminate as many as you want throughout the month. So that was a lot. Questions?
Yeah, Andrea, I'm going to go back to that last slide real quick because I just want to
Okay.
make sure the attendees really can zone in on this. So that $9 per employee per month, that is a TRA exclusive benefit, right? It's a different price if you are not a TRA member. So I just want to really hone in on that and just let everybody know that is an incredible offering, and it's at the employer's discretion if they want to cover that cost for the employee or maybe share that cost. But and with the $0 unlimited copays, I think that's fantastic. And so I really just wanted to highlight that part of your presentation before we dive into the next questions.
No, yep, I love that. And I'm glad you actually brought that up as far as cost share. We're not able to bill the employees. We're going to bill you the employee every month for those employees who are enrolled, right? Who you've got enrolled in the system. And we know that that number is going to be different every month. But so we're going to bill you, and if you're doing a cost share, you would more than likely do that through your payroll vendor. So
Okay.
I was going to say something else and I forgot. Go ahead.
All right, yeah, so a few more questions in the chat. Are digital content and therapy sessions available in Spanish?
Yes, we do have that available in Spanish as well. Absolutely.
That's great. And another question that we have here, is there a minimum number of participants required per employer?
You only need 2 employees to enroll in order for us to turn the plan. So you always have to maintain 2, right? And then you can add and terminate employees at any time during the month. So you don't have to wait until the first of the following month to add somebody. So if somebody comes to you and says, wow, I heard about this great benefit, I want to enroll, help me, I want to get enrolled. You can go right into your client portal that we're going to build for you. You can enroll that employee, and they'll have access within 24 hours for the service.
Awesome. That's it for now. I'm sure there'll be more.
Awesome. Well, that was less than an hour. I think I can't see a clock, but you know what? I also want to leave my email address here. So if you want to reach out to me directly, I'm happy to do that. And I'm happy to show you an app demo as well. But feel free to reach out to me at any time. And I just appreciate y'all having me. So thank you.
Yeah, before I wrap up, I'd like to offer any more additional questions. We will be sending Andrea's deck out to those registered and to those who attended today, along with their contact information. If you'd like to learn more, mental health is a huge part of our lives, right? And the TRA takes it seriously, and we're very grateful to have someone like Teladoc Health partner with us in helping this initiative. Andrea, there actually is one more question before I wrap up. Have you seen any retention benefits from offering this as an employer?
That's a really great question. The only way I can answer that is when I talk to owners of companies that have told us that this really has helped. In fact, I was just talking to a hotel owner who loved it so much that he was going to use it in his interviews as he was conducting them to show, hey, we're gonna provide this benefit to you. But what's nice, and that's actually something I didn't mention, and I'm glad this question was brought up. you're going to, that client portal that we're going to build for you, you're going to have utilization reports that we're going to have for you each month. And in those reports, I mean, they're like 18 pages long. It is going to go into detail of every service that we offer. We don't provide names or any of that, very HIPAA compliant, but you're going to see, are my employees using the benefits? If they're not, you know, how many employees have actually downloaded the app and registered? What services are they utilizing? If they're not really using it, we have a team. You're going to be assigned a client success manager who's going to help you with materials. We can do app drives with your employees, give away Amazon gift cards, meaning, you know, have a contest, and you tell your employees, okay, you have a week to download the Healthiest You app and register. We're going to we're going to have a contest and send a couple $25 Amazon gift cards to those that, you know, in a drawing that have done that. So we have many ways to kind of help you drive engagement and awareness of the product. So, you know, because, I mean, at the end of the day, if you're paying for this, right, we want to make sure that you and your employees are receiving the value. So, I mean, our retention rate as a whole with the hospitality industry is 95%, about 94.8%. So that is telling to me that people are finding great value. So that was a long answer to a very simple question, actually.
No,
Sorry about that.
that was great insight. You know, we all know finding and retaining employees is an incredible issue, or a huge issue within the restaurant industry. And so having some benefits like this that can retain employees is huge, right? And so thank you for sharing your knowledge with us about this and just mental health in general, and the solutions that Teladoc Health provides.
Well, thank you. Thank you very much.
Well, okay. Well, without further ado, if there's no more questions, we'll go ahead and wrap today's session up. We appreciate everyone's time this afternoon. Andrea, thank you so much for being with us. Thank you again for sharing this knowledge. We'll be following up in an email with this deck along with Andrea's information. And have a great rest of your day.